Now I'd like to turn to Dr. Alexander Scott.
Hello.
Hi.
Excellent. So being an adult and pediatric infectious disease physician in this role, leading the state's public health departments and public health response has been a very helpful intersect between applying the science and familiarity with diagnostics and how critical it is, and particularly from an infectious disease standpoint, how it is a tool, not an end, to help determine what's needed for patients, but then being able to incorporate that into the practical realm at a public health level, and in particular, as mentioned, at the community level. When you especially think about disadvantaged communities that have more barriers automatically set up to them being able to access the expanded forms of health that we know are so necessary. So I've definitely appreciated the discussions and highlighting of the issues of testing through COVID and just diagnosis in general, and the importance of using a lens of equity and really taking into account the determinants of health as we do so, with recognizing employment limitations, housing, transportation and access limitations, as well as health literacy, language, cultural barriers, as they've been discussed. And when you look at the practical level of diagnosis, and when you're particularly in this realm where we are now, where many of us are peaking in terms of the rapidity of the Omicron spread that's occurring, it exposes the fact that diagnosis, while intermittent in a point in time, also has to be dynamic. And so earlier conversations where it was heresy to consider, or concerns of safety were expressed about allowing people to do their own at-home tests on their own without any education and monitoring, and how are we going to get the data and the results and be able to calculate our percent positivity at the state level. It is now, at this point, survival. We cannot get enough at-home tests. And many of those very legit concerns have to be put into perspective, particularly when you talk about how critical it is to make sure that our communities hardest hit, that are the same communities disadvantaged by all of the other disparities because of how the systems are set up to create that. When you're overcoming it and using an equity lens, you have to be proactive and aggressive, so to speak, or push even further in what you need to do to overcome some of those gaps, and how we are distributing rapid at-home tests, as an example, into the community has to have that lens of making sure we don't lose those key elements of proper education about it, safety connected to it, ability to report, but then we're also being intentional about ensuring we are prioritizing those communities that are harder hit for the variety of determinants of health reasons that it exists. So that notion then impacts policies, supplies, and other decision making elements that are connected to diagnosis and diagnostics. So that's a snapshot from the public health perspective, and happy to join in.
Perfect. And yeah, no, I think your point that diagnosis is much bigger than the test is something we're going to come back to in this hour.